What are your plans for New Mexico now that the President has made his State of the Union address and that the fiscal year 2011 budget has been proposed?
Well, I think the budget that the President has proposed and consistent with his State of the Union speech is favorable to our state. We have a lot of activity in our state that involves the Department of Energy. And the request in the administration budget is for an increase in funding for the Department of Energy, more focus on energy research and development. A lot of activity that would go on at our two national laboratories, Los Alamos National Laboratory and Sandia National Laboratory. There's also funding in the bill for some of the water projects that we have in our state, particularly the Navajo-Gallup pipeline project, which is very important to the northwest corner of our state. And I think the budget requests the President's made for education funding will be good for us. So overall, I think it's a good budget for New Mexico.
Then what would you have liked to see included in the budget, besides the things that you've gone over?
Well, there are some specific issues that I would disagree with the administration budget on. One is the Lance facility, which is a advanced energy facility there at Los Alamos, and the administration has not proposed funding for that. We think it's important that it be funded, and we will be advocating that there be some funding for that. I think that's a major item. One of the unknowns, of course, is going forward what's going to happen on health care. And I hope that we're able to pass health care reform legislation. If so, that will, of course, mean additional funds for the state and community health centers and other health-related activities.
And if the health care reform is passed, what would, for rural areas in New Mexico, access to medical facilities is very sparse. What would you like to see happen there?
Well, the main concrete thing that would happen with regard to facilities is the construction and the improvement of a lot of community health centers throughout rural parts of our state. In addition, we hope that there will be some increased funding. The Senate version of health care reform provides increased Medicare funding for physicians that will work in rural areas, and so that would help us a lot in New Mexico.
And you mentioned the Department of Energy earlier. The increase in the proposed budget for them, what would that mean to New Mexico?
Well, I can't give you the exact dollar figures, but it's a significant increase in the funding for the work that goes on at our national laboratories. So it'll be a very good thing for our state.